I want to talk about the importance of mood and exercise and diet in ulcerative colitis. We've, over the last 6-7 years, done this huge study called PREdiCCt, where we looked at 2,500 people with Crohn's disease or ulcerative colitis, recruited in clinical remission, and then followed to the time point of flare. And we looked at baseline, when people said they felt well, at a number of key things, including diet, mood, exercise. Plenty of others, but just those for now. We also measured in the blood using CRP and in the stool using fecal calprotectin the measure level of inflammation. And when we analysed the time to first flare, flare being an increase in inflammatory activity with symptoms and a change in treatment, and when we controlled for the inflammation and other factors at baseline like age, biological sex and social deprivation, we found 3 very interesting factors that are associated with hard flare, time to hard flare in ulcerative colitis. The first was a high level of meat intake, the second was depression, and the third was a lack of physical activity. And so these feel like things that we could encourage patients with ulcerative colitis to look out for, and we could screen for, and we can potentially optimize for. Eat a healthy diet, not too much meat, screen and treat for depression, even if that intervention doesn't change the risk of flare, which I think it might do. Looks like depression is probably a biological pro-inflammatory phenomenon. Even if not, screening and treating for depression is a good thing that we're not doing well enough at the moment. And then finally, increasing amount of physical activity. And actually the bar in our study for physical activity that we set was the minimum exercise requirement, which is really not very much. So just getting up and moving on a regular basis every day. Could be a 30-minute brisk walk, it could be a run, it could be a cycle, it could be a swim, whatever it is, looks like it will make a difference moving forwards. So as we think a lot about drugs and the amazing array of incredibly effective therapies we have now for ulcerative colitis, I think thinking more holistically with these hard data that we have, looking at dietary factors, psychological factors, and other behavior such as exercise, very, very powerful indeed. We'll be showing the full results of these studies very, very soon. Those key findings I just mentioned were presented at the ECCO meeting in Berlin in February this year. Thanks, goodbye.